Okay, the topic of today's lecture is sudden natural death. All right, you can see I have underlined the word natural here. Okay, as everyone know that all death is a sudden because it is a sudden, unexpected goodbye. And actually, I like this topic very much, because it reminds me about death. And in Islam, the wisest person is those who remember death often and prepare for it. All right. Okay. So I hope today we learn something about the sudden death. And we need to accept it. And I'm Dr. Wan Faizah Wan Rahman from Department of Pathology, University Science Malaysia. All right. Okay. At the end of this lecture, suppose you should be able to first to define the sudden unexpected natural death, right? And then able to classify the causes of sudden death due to natural diseases. Understand the mechanism of death due to natural diseases, and also able to describe the gross changes of the related organs in relation to pathogenesis of disease. All right. Okay. I know that in previous years, you know about many diseases. All right. Many diseases, you learn about many diseases, but today you should choose a few diseases from whatever you have learned, which disease actually can cause death. All right. Yep. Okay, before that, I hope everyone have read about the notes given in e-learning. It is a pre-lecture notes just for you to get some rough idea on what is a sudden natural death. All right, and then before I proceed my lecture, let's go one by one, the pre-lecture scenarios. All right, this is a pre-lecture scenarios. The first scenario, it is a 20-year-old healthy man died at home after coming back from playing badminton, which is common nowadays. People die after playing badminton. All right. It's okay whether badminton or football, but there is a message I would like to give to you. Okay, so this is considered as sudden and of course really unexpected. This is a young, previously healthy man. So this is considered as sudden, unexpected, really unexpected. Okay, for the second scenario, 55 known case of diabetes and ischemic heart disease, which is controlled, and he's on medication, died at general ward. So now it's still sudden, although this patient have underlying diseases, the known case of disease, but it's controlled and he's on medication. So he's when he died, it's still sudden. And because he died in general ward, he considered as we cannot say expected and actually not unexpected. All right, not really expected and not unexpected. Okay, but for 60-year-old man died after 5 days on triple inotrope in ICU. Okay, this is not sudden anymore, and this is expected death. Okay, you can see now where the person died give you the influence whether it is expected or unexpected. All right, general ward maybe not unexpected, less expected. Okay, because general ward meaning that patient stable as compared to ICU. And this patient on 5 days on triple inotrope, of course, very critical now, and this is an expected death, right? But for 30-year-old man, a motorcyclist died at site after involving in motor vehicle accident. This is sudden, unexpected, but it's not a natural death. All right, this is not a natural death. The manner of death is different. All right, this is accident, not a natural death. And how about the when a 99-year-old granny died in the home. 99-year-old granny died in the home. And this granny don't have a medical problem. Only that she's 99 years old. This is considered as sudden death, but not unexpected. Okay, because it's maybe expected because of her age. Okay, 99 years old. So how long you expect the person can live? All right, but in this case, have to exclude the accident or any homicide. All right. And then 26-year-old man. And this is my cousin, my son to my cousin, what we call anak sepupu. Okay, this is happened about a few days ago. 26 young man, married man with a 3-month-old child, known case of SLE, on medication, but then developed complication. Died after 2 days in ICU. So, what you want to consider this? Expected, sudden, unexpected. But what after all, this is still sudden. This is sudden, but since patient developed the SLE complication, and before die, he was treated in ICU. So it is you can call it expected. Expected because admitted to ICU, treated first before dying. All right. Okay. So this is a few scenarios I've given to you. So just to make sure that you understand what does it mean with a sudden natural death, whether expected or not, because not all the sudden death is expected death. All right. Not all the sudden death is unexpected death. Some certain of sudden death is expected. All right. Okay. So now we go to the definition of sudden death or sudden unexpected natural death. From WHO, sudden death means a death occurring within 24 hours of the onset of symptoms. Okay? 24 hours of the onset of symptoms. And it is a death which are sudden, unexpected, clinically unexplained, or otherwise obscure, even though there need to be no unnatural element. No unnatural element. So must be natural element in their causation. All right. Or it is death that occur in previously healthy individuals, in those with non-material diseases when the severity of the person condition does not explain death. All right. So in sudden death, it can be those who previously healthy, no medical problem, or those with a medical problem, known to have medical problem, but that medical problem cannot explain their death. Okay, not a symptomatic medical problem, and the medical problem is not that severe for the person to die. All right. So in this case, the autopsy play an important role to establish the final diagnosis and to determine the manner or cause of death. So manner of death here, whether it is natural, accident, suicide, homicide, or any other causes. Remember that in this topic, this is a sudden natural death, so we need to exclude the violent or traumatic death. All right. So at least autopsy, from the autopsy, we can determine the manner of death apart from the cause of death. Right. So, the sudden natural death is a death due to the underlying disease, whether symptomatic or non-symptomatic. It's not because of accident, suicide, or homicide. All right. And the sudden death is often the first clinical manifestation of an underlying disease in previously asymptomatic, apparently healthy subjects. In this setting, the autopsy represents the first and only opportunity to establish and register an accurate cause of death. All right. Of course, when we talk about autopsy, although you are a doctor or you are medical students or you are USM staff or you are medical staff, but of course, when the death occur, especially among your family members, you will refuse for autopsy, especially when you are a doctor who involved in this. You know how they do autopsy, and you know how they cut the disease from head to toe, from the skull, and open everything. Yeah? You know that. Okay, of course, everyone will refuse for autopsy, but at least you should know what the important behind the autopsy. Yeah? In certain cases, the the cause of death only can be elicited from the autopsy. All right. So the role of autopsy in sudden death is to establish or to consider whether the death is attributable to a cardiac disease or to other causes of sudden death. After this, we learn about various causes of sudden death. All right. And the nature of the cardiac disease, when if it is from due to cardiac disease, we try to find what is the nature of the cardiac disease and whether the mechanism is arrhythmic or mechanical. All right. And whether the condition causing the sudden death may be inherited, require the screening or counseling of the next of kin. All right. Meaning that it is a genetic disease or not. All right. And then the possibility of the toxic or illicit drug abuse, trauma, or any unnatural causes need to exclude that. And the role of the third persons in death. That's why autopsy is important. All right. So the causes of sudden natural death, more than 80% of cases are due to the cardiovascular system, which is the cardiac causes. And the rest follow by the central nervous system, the respiratory system, gastrointestinal system, genitourinary system, hematological, and others. Okay, you have no problem because all of disease from this system you have covered during your first and second year. All right, so you have no problem with that. Only today, just to refresh all the disease and try to understand, try to choose from what you're understanding, actually which disease that can cause sudden death. Okay, all right. Now we go to sudden cardiac death, which is the sudden death due to heart problem. Okay, cardiac causes. First, of course, the most common is acute coronary syndrome. Acute coronary syndrome. Laser color? Yes. Tak dapat pun. Okay, acute coronary syndrome. 70% are due to acute coronary syndrome cases, acute myocardial infarction or ischemic heart disease. And then followed by hypertensive heart disease, valvular heart disease, like rheumatic heart fever or rheumatic heart disease, the myocardial diseases such as the cardiomyopathy, the inflammatory disease of the heart, like myocarditis, infective endocarditis, polyarteritis, vasculitis. Okay. And then congenital heart condition, like a non-atherosclerotic coronary anomalies, the congenital heart disease. And last but not least, when there is absence of structural heart disease, we call it conduction disorder. All right. So this is one of the important things. I think most of the conduction problem I will tell you after this. Maybe some of you, this is first time you listen about this. All right. Okay. To make things become simpler, we can divide the sudden cardiac death into this, whether electrical or non-electrical. Non-electrical means the structural problem. The structural problem, all previously I have mentioned before, mainly majority are due to structural problem, like the cardiomyopathy, okay, coronary artery anomalies, myocarditis, atherosclerotic disease, all that structural problem. Meaning that when you have the heart, when we open up the heart, we know there's a problem by looking at the gross changes of the heart. All right. But for the electrical problem, there's no gross changes no gross structural changes. Okay, when you cut the heart, there's nothing. All right, that's possible of the electrical problem. Due to conduction system problem abnormality, like in long QT syndrome, the Wolff Parkinson White syndrome (WPW), the Brugada syndrome, the catecholaminergic ventricular tachycardia, the short QT syndrome, and the rest others which is not electrical and not the structural. We put it under others like a commercial cordis and a primary pulmonary hypertension. Okay, so for the heart problem or sudden cardiac death, we have a different definition. So for general sudden death, it's a death within 24 hours. But for the sudden cardiac death, it is a natural, unexpected fatal event from the cardiac causes that occurring within 1 hour from the onset of symptoms in an apparently healthy subject or in one whose disease was not so severe as to predict an abrupt outcome. Okay? So meaning that here the sudden cardiac death is due to sudden collapse of cardiac function that occurring within 1 hour of symptoms. Okay, so pendek kata memang tak sempat nak treat, not even admitted to ICU, and not even treated pun patient dah maybe died at home or ED. Alright, okay. So the most common cardiac causes is the acute coronary syndrome. We call it ACS. This is actually the clinical spectrum of disease due to myocardial infarction that ranging from non-STEMI, or unstable angina. All right. So I think you know that the STEMI and non-STEMI, non-STEMI, no ST elevation myocardial infarction. STEMI is ST elevation myocardial infarction, and we have unstable angina. All right. We know that in myocardial infarction, some of infarction, when it involves the whole thickness of the ventricular wall, the myocardium, the epicardium, the whole thickness, it can cause the changes, the ECG changes. We call it ST elevation. All right. When there is an infarction, but it's not involving the whole thickness, maybe it's not cause the ECG changes, so there is no ST elevation. Okay, but patient have the symptoms of the angina. All right, and then when they test for the troponin, it is increased. Only there is no ECG changes. How about the unstable angina? Unstable angina is patient have the angina, but there's no changes in the ECG, and the troponin also negative. No evidence to call it heart problem clinically, not clinically by the investigation, but clinically the symptom just like a myocardial infarction. So we call it unstable angina. All right, okay. I hope everyone clear about that. And the most common autopsy of finding is severe arteriosclerosis, okay, which is more than 75% is considered severe. Okay, when the occlusion of the blood vessel by the arteriomatous plaque is more than 75%, the lumen only less than 25%, so we call it severe. And the second finding is the myocardial scarring or fibrosis. So the mechanism of death is lethal cardiac arrhythmias. Arrhythmias meaning which is 80%. Is due to the ventricular arrhythmias, whether the ventricular fibrillation or ventricular tachycardia, and about 20% deaths in ACS due to sudden asystole or bradyarrhythmias. Okay. So we can see here how this is a very nice blood vessel, but those with ACS can that there is a arteriomatous plaque of formation stuck at the internal wall. Okay, And look at here, the plaque build up in the coronary artery that blocking the blood flow and oxygen to the heart, cause damage to and death of the heart tissue here, and that causing the lack of blood supply, and altered the conduction system, causing the conduction disturbance and causing the arrhythmias that ultimately causing death. All right. Okay, I hope everyone clear about this. And let's see, during the autopsy, we need to remove the heart like this. This is the schematic cross-section of the subepicardial coronary artery. This is the heart, and this is the anterior part of the heart. This is posterior. And then look at the anterior part. We have the blood supply. This is a left circumflex artery. This is left anterior descending artery, and this is a right circumflex artery. Okay. This is what we do during autopsy. We need to slice, we need to do section to all the blood vessels on the heart like this, okay, and try to examine every blood vessels. Normally, most of the time, what we see is this. This is one example of the transverse cut of the left anterior descending artery, and it appears occlusion by a thrombosis. Very little lumen. All right. So this is atherosclerosis. Okay. And then second, after acute coronary syndrome, we have hypertensive heart disease. Okay. You know that a prolonged high blood pressure give changes to the heart myocardium that cause the left ventricular hypertrophy. Yeah. Other than that, it also caused the coronary vasculature become atherosclerosis because of the blood turbulence that caused the formation of the caused the damage of the endothelium. That after that causing the atheromatous plaque formation, and all this can cause the conduction abnormality, which is arrhythmias. So the mechanism of death also the arrhythmias. Okay, you can see here the concentric left ventricular hypertrophy. This is the left ventricle. This is okay. This is the right ventricle. The hypertrophy causing the narrow lumen, and this is a papillary muscle which is also hypertrophic. Okay? Very thick the free wall here, ventricular wall. This is the septum. This is the wall where everything thicken, causing the lumen become smaller. All right. And of course, in hypertensive heart disease, during the postmortem findings or autopsy, most of the time, what we see is the atheromatous plaque formation. So you need to recall how actually the atheroma formation. And of course, basically, it is due to the high turbulence blood flow during the high BP, and with additional additional high cholesterol, with the smoking habit, all this able to damage our endothelium, that later on cause the LDL. The LDL will cross the damaged wall and forming the plaque that causing the atherosclerosis. This is the diagram of the atheromatous plaque. Okay, so during the autopsy, of course, we will find this, the atheromatous plaque formation and the heart enlargement with the left ventricular hypertrophy like the previous picture, and which is the way we always weigh the heart, which is normal weight around 250 gram, and in case of hypertensive heart disease with left ventricular hypertrophy, the weight can be more than 600 gram. Okay, so the mechanism of death here is due to unstable, irritable endocardial cells that cause the arrhythmias and ventricular fibrillation. All right, this is one of the blood vessels that we do the section and we see under the microscope. This is the classification of the blood vessel wall. The wall and this is the arteriomatous plaque, and this is the little small lumen. All right. Okay. Now we move on to the cardiomyopathies. This is also interesting under the cardiovascular disease that able to cause the sudden death. In fact, in large autopsy-based survey of population in young athlete in US, the cardiomyopathy, especially the hypertrophic obstructive cardiomyopathy, or we call it HOCM, has consistently been the single most common cardiovascular cause of sudden death in young athletes. Okay, not only US, but in all over the world. Okay. HOCM is due to inappropriate myocardial hypertrophy with or without ventricular obstruction. This is, and then the second type of cardiomyopathy, we have dilated cardiomyopathies. It is a ventricular dilatation with systolic dysfunction. And we have restrictive or infiltrative cardiomyopathy. We have arrhythmogenic right ventricle cardiomyopathy. All right. So we'll go one by one after this. This HOCM, of course, this is a genetic problem. It's due to the gene, something related with the genetic or gene mutation that cause the inappropriate myocardial hypertrophy that cause obstruction of ventricular obstruction. But for dilated cardiomyopathy, it's not really genetic. Many diseases can cause dilated cardiomyopathy, in fact, the pregnancy, okay? But for restrictive or infiltrative cardiomyopathy, this is related with other disease. For example, restrictive cardiomyopathy in case of the connective tissue disease like scleroderma, and that cause the thickening or stiffness of the collagen, that further causing the problem with the heart problem, stiff of the heart ventricle wall. Okay, infiltrative cardiomyopathy, for example, in case of amyloidosis, amyloid is a magic substance, magic protein. Actually, it can infiltrate in any organ that cause the organ failure. All right. The arrhythmogenic right ventricle cardiomyopathy, it is a fibroadipose replace the right ventricle. The right ventricle should be solely the myocytes, but then now it taken place by the fibroadipose tissue. So we call it arrhythmogenic right ventricle cardiomyopathy, which is very rare, only for the unfortunate person, which is hereditary disease, run in family, and it is genetic disease. Not everyone have this. Okay. So the most common, the two common cardiomyopathy we have the dilated cardiomyopathy and hypertrophic cardiomyopathy or HOCM. We can see here, cardiomyopathy as a general is a condition in which a ventricle has become enlarged, thickened, or stiff. So as a result, the heart's ability to pump is reduced. Okay. You can compare here. This is a normal heart. This is the normal left ventricle. And this is the normal septum. What happened in the dilated cardiomyopathy? This is the enlarged ventricle. The left ventricle enlarged, weakened the left ventricle, causing the left ventricle become very struggle to pump the enough blood to meet the body's need. It is dilated. You can see the wall, it is thin. All right. But for the hypertrophic or HOCM, hypertrophic cardiomyopathy, we can see here the left ventricle, very the wall, the especially the septum become thickened and stiff. All right. The left ventricle become very cannot relax, resulting in the problem in the pumping of the blood. Okay, it cannot work properly. Okay, in HOCM there is asymmetrical thickening of the interventricular septum. But the key words or in the most important structure we need to look at is the septum. The septum, it is inappropriate or asymmetrical hypertrophy of the septum here, as compared to the left ventricular hypertrophy in hypertensive heart disease. It is not concentrate on the septum, but it thicken the whole the free wall, the free ventricular wall. Okay, and this problem can cause the intermittent cardiac outflow obstruction and cause a sudden death. All right. You can see here, for for HOCM, 100% is genetic causes. But for dilated cardiomyopathy, only 20 to 50% genetic causes. The rest can be non-genetic, like those who taking alcohol, cocaine, myocarditis, those with SLE, all can cause dilated cardiomyopathy. Okay, so for the HOCM, this is the changes of the heart, and basically it is the asymmetrical hypertrophy of left ventricle with disproportionate septum enlargement as compared to a free wall. 1/3 of HOCM run in family, but 2/3 is sporadic, meaning that there's no one in the family has the problem, but suddenly he has, na'uzubillah. Okay, so remember that 2/3 sporadic, only 1/3 is familial. All right. So this is the example of the cross section of the heart in HOCM. Okay, this is normal, and this is HOCM, very thickened, the septum. Okay, look, the septum is very thick. Okay, very thick. Yeah. This is the diagram to show the difference between the normal heart, the HOCM, the restrictive cardiomyopathy, and the dilated cardiomyopathy. Okay. In restrictive cardiomyopathy, this is remind me about one of my friend, which is, I think, died around early of this year, about several months ago. She is a very nice doctor, family medicine doctor, and she has been diagnosed. They have the connective tissue disease known as the scleroderma. After this, you can read further what is scleroderma. And scleroderma, one of the complication is the heart complication, because it is problem with connective tissue. So this later on, it will attack the muscles, the tissue, the muscles in the heart, cause it restrictive. They become very stiff. The heart become very stiff and cannot pump the blood properly. So she died about a few months ago. All right, still very young. She's my junior. Okay. And then other causes of the heart causes is conduction problem. Okay, you need to be familiar with the Brugada syndrome, WPW syndrome, the commercial cordis, the long QT syndrome. Okay, you must be familiar with this. Okay, it is interesting. You need to have a your further reading. Okay, Brugada syndrome. It is a problem with the sodium ion channel. So there will be no action potential at the SA node, at the SA node. And for the Wolff-Parkinson-White syndrome, it is problem with the it is a pre-excitation syndrome due to abnormal accessory pathway between the atrium and the ventricle. This accessory pathway, we call it bundle of Ken. This formation of the bundle of Ken in certain condition to survive. All right. Okay. And then commercial cordis. This is also interesting. It's very unfortunate to have this. We call it agitation of the heart, or R on T phenomenon. It is a result of a blow directly at precordial region at critical time during heartbeat cycle. You know, someone just beat, betul-betul kena pada heart, suddenly collapse, mati. kalau kita tengok tak supposed to die lah, but very unfortunate dia punya tumbukan tu betul-betul kena pada masa yang critical time of during heartbeat cycle, causing the sudden death. We call it commotion cordis or agitation of the heart. A long QT syndrome is due to hypokalemia, magnesium, or calcium, and we have congenital short QT syndrome. All of these, the COD is the cause of death, not the cash on delivery, and the conduction problem causes arrhythmias. Okay, now what is actually the fatal arrhythmias? Fatal arrhythmias, which is commonly in young athletes. Fatal arrhythmias, of course, I did mention just now, the most common is HOCM, due to thickened heart muscle or septum. And then the second common is anomaly of the coronary artery. We call it ACA, anomalous coronary artery. Whether the left artery from the right sinus or the myocardial bridging. Okay, myocardial bridging. Okay, of course, I know everyone, all of us don't know that we have this until one day, kalau umur panjang, still lagi survive, and suddenly you become fainted, collapse, and we found that there is problem with your heart, and only that you know you cannot have you need to avoid the vigorous exercise or any competitive sport. Okay, for example, this is happened to my husband. He has been diagnosed myocardial breach about 2 years or 2 years ago. Okay, this is a myocardial breach. Myocardial breach is considered one of the problem with the anomaly of the coronary artery, which is it is a congenital. It's a congenital problem, but then it only appears later when you have vigorous exercise, when you have in stressful condition, only that things appear. You can see here how the myocardial breach, by right, the blood vessel should be on the top of the myocardium or epicardium. Okay, but then it become deep into the muscles. Whenever the heart pumping or stretch, so the blood vessel also stretch. Now also not compress, right? So that cause a problem. Okay, chest pain. And then long QT syndrome, inherited heart rhythm disorder, the WPW syndrome, the abnormal extraelectric pathway that causing a premature beat, and then congenital heart disease, and also the commotion cordis. This the common top disease that fall under the fatal arrhythmias in young athletes. Okay. Okay, this diagram just to show you how actually the Wolff-Parkinson-White syndrome. It is extra bit lah patient. Kalau kita examine dia punya heart sound, memang ada bunyi extra due to extra beat. Okay, patient it actually in certain condition there is a formation of the pathway that connect between the atrium and the ventricle. We call it abnormal, the bundle of Kent. The abnormal extraelectrical pathway that allows the heart to beat prematurely, leading to tachycardia. Okay. This is the normal electrical pathways. Okay, like this. But here, this is a abnormal electrical pathways. Okay, all right. So when we talk about arrhythmias, whether it is too fast or too slow. If too fast, we call it tachycardia. If too slow, it is bradycardia. And if it is too early of the heartbeat, we call it premature contraction. Okay? And if it is too irregular, we call it fibrillation. All right? This is a diagram to show you about the commotion cordis. Sudden death of a healthy individual with no underlying cardiac disease due to ventricular fibrillation. following a blunt, non-penetrating blow to the pericardial region of the chest. Okay. And then next is due to aortic catastrophe. Okay. We have two here. Aortic means that the problem with the aorta. This is not a problem with the heart, but it's considered as cardiovascular problem. Okay. Vessel problem. The first is aortic aneurysm. The second is dissecting aorta. Aortic aneurysm. Aortic aneurysm is a localized dilatation of the abdominal aorta. You know the location of the abdominal aorta? Those who presented men more than 60 years old, for example, 65 years old man presented to you with sudden onset of abdominal pain. Don't say, no, this is gastric, brother. No, just open, let's examine the abdomen. You need to palpate the abdomen, okay? Those who have a very large pulsatile mass at the middle of the abdomen, you must suspect for the AAA. We call it AAA, abdominal aortic aneurysm. Okay, this is example. You can see here, the aorta become dilatation, large abdominal aneurysm. We have many cases like this. Okay, and most of the cases is misdiagnosis because the doctor not palpate properly and no gut feeling, tak cukup ilmu, tak cukup experience. Alright. And how about the dissecting aorta? The hypertension that can cause blood to dissect through the innermost layer into the middle layer, like this. And those who have hypertension, the turbulence blood flow later will cause the dissection of the, it become two part of the blood layer, middle and the inner. Okay. And this phenomenon, we call it aortic dissection. All right. So these two phenomenon actually can cause the aortic catastrophe. Later on, can cause sudden death. All right. Okay. Finish cover about the cardiovascular system, which is 80% of the sudden death due to cardiovascular systems. Now we have another 20%, which is from other system. The first, the second after CVS is the central nervous system disease. Okay, the central nervous system, the most common is due to the spontaneous subarachnoid hemorrhage. The two common under subarachnoid hemorrhage is ruptured berry aneurysm and arteriovenous malformation, AVM. And then the rest, we have epilepsy due to status epilepticus, infection, acute meningoencephalitis, intracerebral hemorrhage, cerebral infarction, and others, brain brain tumors. Okay. First, we go to spontaneous subarachnoid hemorrhage, this SAH. The most common subarachnoid hemorrhage is trauma, accident. The most common subarachnoid hemorrhage is accident. And then, but for non-accidental or non-traumatic subarachnoid hemorrhage, we must think of two different blood vessel problem. We call it, first is ruptured berry aneurysm or circle of Willis, and second is the arteriovenous malformation. All right. This is the gross features of the brain during the autopsy. Upon removal of the skull, this is the brain. You can see here the brain is very hemorrhagic. We take the water and try to wash, but it's not removed by washing. So meaning that the blood is not the outer surface, but the blood within the subarachnoid space. All right. So this means that this is subarachnoid hemorrhage. whenever we have the subarachnoid hemorrhage like this, we need to find where is the causes. So the most common causes is from the rupture from the circle of Willis, or we call it berry aneurysm. So we need to find where is the location of the berry aneurysm and try to remove the blood vessel intact, one by one. Okay, one by one. Take out the circle of all the blood vessels and examine where exactly the point of the aneurysm. For example, in this picture, we found that 3 aneurysm here, here, here. These are the causes of the hemorrhage in this patient. Okay. So the circle of Willis has been dissected and 3 berry aneurysm are seen here. So we consider that this is a multiple aneurysm. Multiple aneurysm can be seen in about 20 to 30% of cases. The aneurysm is considered as congenital in the sense that the defect in the arterial wall is present from birth. But the actual aneurysm takes years to develop. So that rupture is most likely to occur in young middle-aged adult, 30 to 40. But earlier can be earlier if the person is smoker, chronic smoker, or if the person have the underlying medical problem like hypertension, it may be earlier. But if person is healthy and taking care of his health with a healthy lifestyle, it's maybe can go higher or 40 to 50. All right, so that's why we call it congenital, because the problem, the defect occurs still present from birth. All right, but it only developed later. Okay. So this is a very nice diagram. This is a very nice diagram for the circle of Willis. Diagram always very beautiful, but in real life, it's not as beautiful as the picture. The same thing, the disease is not as follow your textbook. Sometimes it's different, and that's why you need to see the patient. All right. This is the diagram of the circle of Willis. You can see here from this diagram, the most common affected are about 90% occur at the anterior circulation of the circle of Willis. For example, here at the anterior communicating artery, at the middle cerebral artery here, about only 10% of the ruptured berry aneurysm occur at the posterior circulation. So the pathogenesis of the ruptured berry aneurysm, actually the etiology is unknown. As I did mention previously, it is actually congenital, but then it will be increased risk later with the lifestyle, and also can be increased risk in inheritable disorder, like those with autosomal dominant polycystic kidney disease, for those who has the Ehlers-Danlos syndrome, a neurofibromatosis type 1, the Marfan syndrome, and can be congenital or acquired. So, congenital when there is a maldevelopment of media at points of arterial bifurcation. Acquired when there is degeneration and fragmentation of the elastic due to age or arteriosclerosis. All right. So the clinical features, those who have the subarachnoid hemorrhage, the clinical features is they will come to you if kalau sempat pergi emergency lah, but sometimes most of the time they collapse at home. Alright. Kalau sempat dia datang ataupun sempat dia complain, he will say that this is the worst excruciating headache in my life. This is not the migraine, not the typical migraine, but this is the worst headache that I have ever had. Although at that moment, the patient still lagi kita nampak very good, conscious, but it's very painful. Kalau kita ingat migraine, bagi ubat migraine, bagi balik, tengok, tunggulah berita esoknya, patient die at home. Pergi hospital, pergi klinik, doktor bagi ubat migraine. Okay, Sebab itulah, we learn from the experience, examine, assess how worse is the worst, how dia kata sakit tu macam mana sakit dia. Tengok everything dari segi kerutan muka, macam mana cara dia sakit. Kalau dia betul-betul sakit, it's not migraine anymore lah. Okay. And then after that, patient will become loss of consciousness lah. Okay. And then we need to actually, for those patient like this, kena urgent CT scan. Urgent CT scan to see any. But most of the time, if the hemorrhage is very severe, we cannot difficult to manage. Okay. So the mechanism of death in ruptured barrier aneurysm is actually the subarachnoid hemorrhage from a ruptured aneurysm is more of an irritant producing vasospasm. Okay. So the mechanism is due to vasospasm, not due to the mass lesion. All right. And then the second, the second is due to the AVM, arteriovascular malformation. The definition of AVM is the conglomeration or mixture of arteries and vein without capillary bed. Okay. It is the most common clinically significant vascular malformation, which is male higher than female, presenting as a seizure disorder, headache, or neurological dysfunction. And the most common site is the territory of the middle cerebral, particularly post-branch, but can occur anywhere. Okay, now you know the importance of the capillary beds. Okay, by right, in normal condition, we should have the capillary beds here. Okay, so the capillary bed is important for the blood to slowing down, to permit, to allow the exchange of food, oxygen, and nutrients into the tissue. But in condition like AVM, there is no capillary bed, so we cannot control the speed of the blood vessel. The blood vessel very high speed and mix up in the junction here. There's a less of the exchange of food, oxygen, or nutrients. So later it become hemorrhage here. Become rupture and hemorrhage. Okay, understand? And then epilepsy. Epilepsy is one of the cause of sudden death, but less common. Now, usually patient found dead in bed in the morning may or may not exhibit seizure activity prior to collapse. The mechanism is believed to be cardiac arrhythmias. Okay, the autopsy finding usually negative. Nothing you can see, but most often we found the bite wounds to the tongue, but it's not specific. And there is sclerosis of the Emmons horn within the brain. All right, but we need to do the toxicology test, and most of the time there will be absent or subtherapeutic level of anticonvulsant. Patient tak ambil ubat. All right. And then infection, acute meningoencephalitis. This is a rapidly developing inflammation of the subarachnoid space that located within the layers of tissue covering the brain and spinal cord. The subarachnoid space here. Okay. The brain is covered by 3 layers of the tissue, which is, we call it meninges. Okay. And this space contains the cerebral spinal fluid, which flows through the meninges, fills the internal space within the brain, and help the cushion the brain and spinal cord. Right? So the sequelae of the meningitis, the mechanism of death in meningitis, when there is a infection of the of that area, there will be this brain edema. The brain edema cause the brain shift, and this we call the brain shift, and later we cause the brain herniation. So the brain herniation is actually the cause of death in meningitis. Okay. This is an example of gross findings of patient with purulent with the meningococcal meningitis. You can see here this is actually just a like pus-like material, and this is a very purulent meninges due to the Neisseria meningitis. Okay, this can be outbreak. This can be outbreak. That's why we need to take this for those who going to haji. Sebab we need to avoid this. It always previously it is outbreak in those who tempat yang apa tu compact like a military barracks, dormitories. Okay. And then we have intracerebral hemorrhage. Just now, subarachnoid. This one, intracerebral hemorrhage. So, intracerebral hemorrhage, 45% is due to hypertension. The usual sites is involving the basal ganglia, the thalamus, the pons, cerebellum, the subcortical white matter. The causes of the intracerebral hemorrhage other than hypertension include the amyloid, the AVM also, the tumor, the bleeding problem, the drug-induced like a cocaine, right? The intracerebral hemorrhage usually it is spontaneous. It's non-traumatic. For traumatic is subarachnoid, but intracerebral hemorrhage is deeper, usually spontaneous due to these other diseases, not traumatic. And it is fatal if affect large portion of the brain and then can extend into the ventricular system. Okay? That causing the increased ICP and later on develop brain herniation that lead to death. All right. This is example of the hemorrhage that involving the basal ganglia here, the putamen area that tend to be the non-traumatic and caused by hypertension, which damage and weaken the small penetrating arteries. All right. A mass effect with midline shift, often with secondary edema that may lead to herniation. So brain herniation is a fatal condition that can lead to death. All right. Usually, in patient presented like this, is a very less likely to survive. It involves large area, a central area, the putamen, basal ganglia area, and most of the time, patient presented like this. Their presentation is sudden loss of conscious, collapse at home. I have my cousin like this. She is that time is 40 years old, no case of hypertension, control hypertension. I'm not sure whether control or not, but she's on medication for hypertension. Suddenly collapse at home, and we bring her to hospital, do the CT scan. We found that there's a massive intracerebral hemorrhage due to the maybe uncontrolled hypertension. Okay. And then cerebral infarction. Cerebral infarction is actually is a ischemic condition of the brain that causing the persistent focal neurologic deficit in the area affected. Okay. So infarction is due to the most of the time due to the ischemic stroke lah. Ischemic infarct. We have hemorrhagic infarct and ischemic infarct. Okay. But the ischemic infarct, for example, there's an infarction of an area of the brain due to loss of the blood supply, due to blockage of the blood vessel that supply of the brain. The infarcted area appears hemorrhagic and ultimately get fibrosis. All right. So we have emboli infarct and the atherothrombotic infarct. Okay. Hello. Tengah ngajar. Kejap deh. Ada ke apa? Okay, sorry. Okay, I record. Okay, when we talk about cerebral infarct, you know that the infarct, there's okay. The cerebral infarct meaning there is a emboli, and most of the time due to the emboli, the infarct or parking dekat blood vessels within the brain, okay, which is it can occur abruptly. You know, when we talk about cerebral infarct, my mind keep thinking about someone. He's our lecturer in here, our lecturer. I think you all know him. Okay, he's suddenly presented with a one side body weakness. He's still a young lecturer, USM lecturer. One side body weakness. But now he's resolving, but not fully recover, not fully resolved. Okay, you know, when we investigate, what we found, there's a what we call there's a thrombus, a thromboembolic we found within the heart, which is the heart. The heart, we have a pattern foramen ovale, and there's a thromboembolic from there, and then that emboli going to the vessel, the blood vessel in the brain, and blockage there within the internal capsule. So the patient presented with sudden abruptly cannot weakness of the body weakness. All right. But luckily it's not that severe. We can still treat, and then now at least can continue work, although it's not fully recover. Okay. When there is a substance, this substance actually cause the release of osmotically active substance like arachidonic acid, electrolytes, semua within the brain that cause cerebral edema. Okay. This is aggravated by the vascular injury and leakage of the protein in the interstitial space. And if we not if the things that cause a severe infarction, if it is severe infarction, the death can occur from the massive hemispheric infarct. It's caused by the cerebral edema and herniation. So the mechanism of death due to cerebral edema and herniation, but not due to loss of the brain tissue. We have no problem if we have loss of brain tissue. No problem. Let's say our brain, half our brain is infarct. We have no problem with that. Maybe loss of memory, loss of everything, but not causing cause of death. Okay. But when there is a herniation or edema, that's cause the mechanism of death. Okay, and we have another cause of death is due to undiagnosed brain tumor. You know, most of majority due to the higher grade tumor like a glioblastoma. 50% of primary brain tumor is due to astrocytoma. But normally, those who diagnose as astrocytoma takes about years, maybe less than 1 year, still survive. But the problem is, it is when it is undetected. Because of what? Because the presentation of the patient is quite different. For example, those who have a brain tumor that involving at the area of the dia punya behavior that causing altered behavior. So patient presented with altered behavior. So the diagnosis will be psychiatric problem, and then we treat him as a psychiatric problem. Okay, and admitted to PSY1, and then we don't know that he has brain tumor until one day he died. Okay, but it's very rare. Nowadays, we need to exclude the brain tumor before we diagnose a psychiatric problem. I have my friend. My friend is he's a doctor. He's one of the surgeon. He's a surgeon. My batch diagnosed the grade 4 glioblastoma. Okay, about few months ago, and now become worsening because the glioblastoma is the very high grade tumor, on treatment, but of course, it's become worsening. Cannot remember even the family members. Cannot remember. Cannot not recognize even the family members or their close friends now. All right. So we have many patients. Not only our patient, but including our friends, family members that cause us to know the disease well. When it happened to us, happened to our family members, happened to our friends, so we learn more. Okay, we learn more about the disease. And the disease, the sudden death due to the respiratory problem is a minority of cases, but the most common is pulmonary embolism, followed by the bronchial asthma, pneumonia, and PCB. All right. This is a pulmonary embolism, the blockage in one of the pulmonary arteries in your lung due to embolus that come originally from the leg. After long traveling, the blood clot in the leg after long traveling, less movement of the leg after major operation. Okay, and this clot will travel to the heart. From the heart will travel to the one of the blood vessel in the lung. Okay, stop here at one of the blood vessel in the lung. So causing the pulmonary embolism. Yeah. So this is the most common findings for those who pulmonary embolism. There is the stuck here, the obstruction here at this, we call it saddle embolus. Okay, the occlusive pulmonary saddle embolus from the autopsy of the 69-year-old man who was found dead in hotel room following a long car trip. Okay, bear in mind that you need to, even though you are in plane for about how many hours? The 14 hours from here to UK, 14 hours, very long trip, okay? But you need to walk around in the plane. Cannot just sit down static, especially for female, all right? Okay. And the other system, like gastrointestinal system, is very rare, like acute pancreatitis, perforated appendicitis. Okay, no battery. All right. Acute pancreatitis, perforated appendicitis, or massive bleeding due to upper GIT bleed. But this one, how massive the bleeding is, but you can still able to manage. But if the massive bleeding at home or nobody at home, patient may be collapsed. It can cause death. All right. And death due to genitourinary system, like acute pulmonaritis, it can occur but rare. So this is my second last slide. I think the 5 common causes of sudden death in real life. First is fatal arrhythmias. So you should list down all the diseases that I have mentioned before, the disease that cause a fatal arrhythmias, and then followed by the acute myocardial infarction, intracranial hemorrhage or massive stroke due to cerebrovascular accident, the massive pulmonary embolism, the acute aortic catastrophe like aneurysm and dissecting aorta. I think that's all from me. Life is too short. The closest to us is death. From all this, I hope everyone trigger everyone to know more, to learn more about certain disease, especially diseases that can that able to cause a sudden death. So please go and see your patient. Tapi tak boleh sekarang sebab COVID. Okay, lepas ni, make sure you go to ward, clerk case, see your patient. And whenever you have a disease surrounding you, whether it happened in your family members, among your friends, whoever that you interested to know about disease, please take your time to learn, to study everything about that disease. So by this, you become better and better. You become very good in every disease. Make sure from the disease, you know the pathogenesis, the pathophysiology of the disease, and the causes, the causative causes, and then how the disease can cause a death. Right? All right. I think that's all from me. Any question? Just unmute yourself. Ada soalan ke? Jelas ke semua? Okay, my lecture note nanti saya akan share dekat e-learning. Tengoklah recording. Kalau okay, saya letak. Okay, record. Stop recording.